Divine Aqua. We have Dr. Christy Divine Akwawo, a consultant, public health physician, lecturer, and researcher in health management, policy, and global health. She's an associate professor in the University of Uyo and currently the deputy CMAC and director of research and training at the University of Uyo Teaching Hospital. She is a graduate of the University of Calabar, Nigeria, London School of Economics, and London School of Hygiene and Tropical Medicine, a fellow of Kofi Annan Global Public Health Leadership Program, and a fellow of the National Postgraduate Medical College of Nigeria, an avid researcher and advocate for universal health coverage, and as a director of Institute of Health Research and Development, UETH, she seeks to strengthen and institutionalize research, forging collaborations across international boundaries. And of course, she's present here today with us at SEAS Nigeria with a warm and resounding applause. Please celebrate our first call to Dr. Christy Akwawo. Is this okay for her, or can we bring this? How do we finish? This way. Okay, so can this be here, or she can just?
Yeah, you can.
Do you need this?
You can keep it
You
here.
need it. I don't mind. Okay, please bring it towards us. Online participants, I didn't hear you guys clap. Oh. Are we there? Are we present?
Yes, we are.
Thank you for that. Oh, we have a class in 1 year.
Good morning, everybody.
Good morning, ma'am.
Ever since I walked into this room, the first thing that struck me was that the average age in this room is probably less than 30. It's a group of young people, and I love being with young people. So I'm feeling very much at home and welcome. And there was something that my bio didn't capture. I don't know how we missed that. But I like styling myself as an advocate for universal health coverage and digitalization of the health system. I mean, that's why I'm here, right? I'm not an AI expert, but I'm an advocate for integration of AI into our work and for using AI to make our work and our health systems and our educational systems, whatever systems we are using, better. So thank you very much. I want to say thank you to the Summer Institute of Computational Social Science Nigeria for inviting me to come talk to you about the challenges of social science research in the era of artificial intelligence. I thought this was a well-suited way to coin what they wanted me to deliver. All right. So we're going to use the yeah. We're going to be going through this topic. I'm not happy that it's not showing. I mean, I'm not happy that it's not. Yeah, better. Thank you. Yeah, so that everybody goes along with me, right? Yeah. So, welcome, sir. So first, I'll be talking about the complexity of social problems. Why are social problems different We do research on, different things, but social problems are peculiar. And we're going to talk briefly about traditional versus computational social science, the challenges of computational social science, and then the various challenges are as listed: information reliability, misinformation, knowledge inequality, geographic representation, the challenge of gender bias. All of these are social challenges when it comes to computational social science research. And then we'll talk briefly about responsible AI integration. So, next slide, please. I wish I had put changing. Okay, so social problems are ubiquitous. They are here with us for as long as there are human beings and there's societies and you know, there are always social problems. The interesting thing about social problems is that they don't have a single causative factor. Usually, you would have them having multiple causes, and these multiple causes make them difficult to fix. And what are the problems that we can call social problems? The problem of poverty, unemployment, inadequate access to health care, weak governance, gender inequity. All of these are, types of social health problems. Are there other social health problems you can think of?
Inequality.
Yeah, inequality, gender-based violence,
Inclusion. Lack of inclusion.
lack of, yes, social inclusivity, right? All of these are social problems. And these problems, because they don't have a single cause, they behave like systems, right? They are not isolated events. There's a lot of interconnection among them. So that is why the next slide shows the characteristics of social problems, all right? And the first is that there's the problem of interconnected, the characteristic is of interconnection. Please move to the next. Okay, I am now holding that.
Yes.
Is this it? This this one. Okay. All right. Okay, I went back. Okay. So the first characteristic is that of interconnection. So imagine the problem of youth unemployment. All right. Youth unemployment would be caused by poor quality of education where the youth is or what he got. The family did not have enough to send him to a good school. Maybe that child is a migrant, parents are migrants, and he finds himself in a society. It may also lead to mental health, all of mental health problems. So there's interconnection. Also, there are feedback loops, right? In trying to solve one problem, or in just that problem, is not alone. Like I said, they behave like systems. There are feedback loops. This connects to this. So poverty will limit access to healthcare. Poor health will lead to reduced earning capacity. Reduced earning capacity will come back and become poverty. All right. So those are some of the characteristics. And then we have the problem of stakeholder complexity. There are multiple stakeholders. Governments should have a role, NGOs are interested, individuals, agencies, and each of these stakeholders has a different incentive. All of them have their own incentives at any point in time when it comes to social problems. And when you think of their incentives, it makes it difficult when you're trying to create an intervention because you're going to have it difficult to satisfy everybody's um, um, interest, and then it will slow down your action. And most social problems generate large volumes of unstructured text. So, I mean, that's why they're here. So you're having the news, you have your reports, you have social media, you have complaints, you have policy documents. These are all various places where you're going to have sources of either you're going to be able to trace that this social problem is coming from there or the effect. So all of these, different unstructured text is not easy for humans alone to process it. All right. Then we have another characteristic of, well, information asymmetry and knowledge inequality. Information asymmetry in the sense that I have a problem. I don't know that there is a solution to my problem. I don't know where to find it. Some people know about my problem, but they can't even know, they don't know where to see me to solve my problem. So, and then knowledge inequality, we'll talk more about that as we go along. There is a divide. Okay, and then slow feedback on outcomes. Impact of a social intervention may take many years to show a result. For example, you want to combat malnutrition among children, maybe children under 5, and you are worried because their educational status has been affected. So you're looking at impact of malnutrition on children. However, you now start carrying out interventions to address the malnutrition that will eventually improve their cognition. It takes a long time for you to see the results. So because of that, it takes a long time to correct. So it's this lands, okay. So those are all the challenges or the characteristics of social problems. Now, traditionally, social science has been dealing with social problems. And traditional social science would rely on surveys, qualitative surveys, the interviews, the experiments to study behavior, or usually on a small scale, and prioritizing deep explanatory theories. But computational social science, I wish I were here yesterday because I'm sure you had a beautiful introduction to what computational social science is. Okay? This leverages big data, machine learning, simulations, okay, to analyze large-scale digital traces and social media interactions. And it focuses heavily on predictive modeling and broad network patterns. I saw this table online and I thought it was a very beautiful thing to tell you the difference between this is traditional social science and um, computational social science. So while traditional social science relies on surveys, interviews, and you have experiments as its data source, big data, social media posts, mobile metadata, and digital footprints is what computational social science is using. I remember that there's one group we have had for over 6 years now, and they talk about we try to answer questions to women, to pregnant women. So it's a group that you join when you're pregnant, and then we answering questions as doctors, medical personnel answer. After 7 years, we actually analyze that data. So this is the kind of thing we are talking about. We are about to publish that. So it uses social media posts. We are looking at, we are tracking digital footprints. What are people saying? What are the things emerging? What are they asking questions? And then the scale and scope for traditional social science research, use smaller, highly targeted samples. So you have high depth but it's limited breadth. For the computational science, you have massive population level data sets, broad breadth, often lacking qualitative depth. I remember when she said, when they asked how was yesterday, she said intoxicating. And what was intoxicating her? The sheer availability of data. We are totally surrounded by data. And the research goals for traditional is theory building and uncovering the why behind human behavior. But for computational research, it's prediction, pattern recognition, and simulation of dynamic social systems. And primary tools for analyzing in traditional social sciences, statistical packages, quantitative coding, and structured questionnaires. But when it comes to computational social science, we're talking about Python, R programming, machine learning, and natural language processing, which is the form of AI. Machine learning and the NLP are AI. Then collection method include active data collection. This is researcher prompted. And so most likely you have structured information. But for computational social science, it's passive data collection. So we are just looking for naturally generated trace data. Okay? Now, so now we are in this era of AI. You know that 2021 there was an explosion with the onset of ChatGPT, generative AI. And so we are now in the era of AI, and because computational social science uses social science data, AI, data science, and computational methods, these become very dependent on the quality of data that you're finding. So we are just seeing things that we didn't ask the questions, we just go and see the questions and we want to make sense of it. This throws up a lot of challenges. And remember, it's garbage in, garbage out. If you put in poor quality data for your research, you have poor results. And better data will lead to better evidence. So what are the specific challenges? Okay, someone is asking, are we following along? Please, are we following?
No, it's online. No, it's online.
Yeah. Okay, are the online participants hearing us?
You can unmute yourself and record.
Yes.
Okay, all right. Okay, so this didn't show well. The specific challenges include, I'm going to be discussing each of them one after the other. Information reliability, misinformation, knowledge inequality, public health knowledge, and geographic misrepresentation. Okay? Oh, don't worry, let me just go. We've moved it twice. We've moved twice. Yeah. So let's go to the next one. So information reliability speaks to the extent to which information that you have is accurate, credible, verifiable, and trustworthy. How do we make data that we didn't ask for it, but we want to make sense of it? The information that we have should be accurate, credible, verifiable, and trustworthy. Now, what are the threats we're having now in the AI era? You know that there are loads of fake websites. I keep getting invites from people saying, please, we want you to come and we saw your paper online and we want you to come and speak on this conference. And really, you go and see a website, but it is fake. So there are so many fake websites. And then fabricated citations. You have been taught that AI hallucinates.
Yeah.
If you go to ChatGPT and tell it to generate a paper for you, it will generate. And you say give me reference, it will give you reference. So it doesn't matter, it will just give you. So this becomes a threat. If you pick up that work and you use it, it becomes a problem. And then the existence of predatory journals. Some journals are fake, they're not real. Okay? They just want to make money out of you. And then manipulated statistics. It's been seen that who has heard of retracted journals,
Yes.
retracted articles. You see that some articles have been published, a lot of times the researchers come and say, oh, sorry, that result was manipulated. So this one is very real, okay? And it is very unethical of us as researchers to use data that is manipulated. And then unverified AI generated content. This is a problem. So what do we do for information reliability? So I decided to just say the best practices. What should we be doing for information reliability? Please cross-check your sources. Prioritize peer-reviewed research. Don't go to predatory journals. Verify citations. Use AI as an assistant, not authority. Maintain transparent documentation and adopt reproducible research methods. So what we advocate for is ethical use of AI for research. Always having a human in the loop. That's what we say. There must be a human in the loop to verify that the information that you have seen is actually accurate. Okay? Then we go on to the next challenge, which is misinformation. Okay, let me go to this. There's a difference between misinformation, disinformation, and malinformation. So while one does not, is not, it didn't misinformation, it was not intended to misinform you. That's the truth. They didn't intend to tell you a lie. Misinformation is unintentionally published inaccurate or misleading information, but the person didn't intend it to be misleading. Disinformation is when the person deliberately fabricates or manipulates information. During COVID, we saw a lot of disinformation. A lot. Then, but malinformation and disinformation actually has to do with publicly available information. But malinformation is when someone has maliciously, deliberately published sensitive, private information with altered content. Okay? So, all these make it difficult for us to have useful or accurate source for social science research. So the challenge is that we will have polluted data sets, there will be distorted public opinion measures, you have reduced trust in science because a lot of people after saying, they say, oh, it's not possible now. I remember one of the stories I saw during COVID. You see, they were carrying people in buckets into a big fire. Very scary. But because at that time, nobody knew what was happening. Nobody could understand. It was very scary. But so at the end of the day, when they started saying, you should go and take vaccines, of course, those were part of the things that gave rise to the vaccine hesitancy and the resistance that we saw. So it leads to reduced trust in science and the manipulated narratives and the influence on political and health behavior, such that if you now want to go and tell your government and say, please, we have changed our mind, though. Let's correct it this way. The position of the can be and say, people are not serious. Okay? Then the challenge of okay, all right, I just decided to add this. AI can actually help in combating misinformation. We can do AI powered fact checking. For example, how many of you have worked with Claude? How many of you do Claude? Yes. You can actually tell Claude, please verify the information. These references you given me. Claude it's crazy. That's the only way I can describe it. Because Claude can make you do anything. You can do anything with Claude. So Claude can actually verify. So you can tell it. Verify. In fact, one day I finished doing a write-up and I asked AI to verify whether it is AI I used. And it verified, it said yes. And it told me why. It gave me the pattern. Do you understand? So that's why it is very important for us to use, we can actually use AI to verify what we are doing. And then verify training data sets. Please don't use a data set you have not verified. Okay? We can use multiple trusted data sources, okay, to compare, and then collaborate with fact checkers, okay, and then we leave the human in the loop, the human to validate AI outputs, and then we need transparent data cleaning procedures. All right. Then the next challenge is the challenge of knowledge inequality. Now, knowledge inequality refers to unequal access to information, education, research outputs, and digital technology. That is knowledge inequality. But I'm sure you've heard of the digital divide. So the digital divide refers to this one is more like infrastructural. When you don't have access, the child in the village does not have a computer, and we don't have electricity to power. That's the digital divide. But knowledge inequality is that you have access to this information, but you don't even know how to, interpret it or utilize it to solve your problems. Okay? So, and this is rooted in the knowledge gap hypothesis that says that when knowledge comes into a particular population, that usually the people in the higher socioeconomic class are the people that will benefit and use it, and it further pushes. Yes. Widens the gap. Okay. So what would knowledge inequality be? So that was why this my picture there is not showing very well. Of course, I'm sure you know my picture is AI generated. I always acknowledge the use of AI. So you see that child on the other side, there's a bridge there, a wired bridge. He's on this side, he doesn't even have access. But this person is here inside, in fact, this person is in sci-fi, right? And generating all the knowledge, is not even getting to him. So what would be the challenges? You will not see that boy's voice in your data set. He's missing totally. So missing voices, then the language barrier. So have you heard the AI speak video? They just launched Usen. Yeah. Who launched Usen? Who is the person that did Usen? Oh yeah, they just launched Usen. Beautiful. Because for you to get you understand? You have to, I have to speak our language. Well, I saw a very funny, what do they call that thing? A TikTok thing where they say, I just told AI to say I think Psalm 23 in the video. Oh my God, you will laugh. Yes, but we need to teach AI. Yes, yes. So there's language barriers, the digital divide, the limited internet access, okay, and underrepresentation of low resource communities. Okay. So how do we address the knowledge inequality? We need to publish in open access journals. So we encourage that whatever we publish, we should use open access journals, and we should develop multilingual AI systems, right? And so we say thank you for hearing our voice. And then community-based data collection. Okay, let's not just sit in our offices, in the hotels, and get data. We should go to the community, interact with the community, and get community-based data. And we need to digitization of local knowledge. For me, one thing that sits very dear with me is the fact that the universities have accumulated so much project work that you don't see anywhere. And it speaks to our context, it speaks to what we are doing, right? So how do we digitize that and make it available? And then international research partnerships, thanks to the Summer Institute of Computational Research. I hope that we'll be able to build an international partnership and do a paper that is going transcontinental, international, and then need AI support for local languages, right? Then the next um, challenge is that public health knowledge, which is meant to be available, right, for everybody to use, scientifically verified information supporting health and well-being decisions, now becomes threatened because people are posting so much misinformation you don't know. I remember when all of a sudden they started talking about, how did they call it? They call it blue lens or something. And people dropped their lenses and started wearing that thing. I don't know. And it was, they said there was research, it was published online, very misleading. Yes, blue, something blue code or blue code, something like that.
Okay.
You
During
know?
surgery.
Yeah, no, not during surgery. Like they will tell you, "Hey, it will solve all your eye problems."
Okay.
So these are, because so there's rapid spread of health misinformation and there's complex scientific language. In most times, scientists we speak in our jargon, and we forget that the lay person needs to understand what you're doing. And there's fragmented health data with outdated information sources. There's also the challenge of cultural communication barriers. So how do we address that? So for public health research, we would like AI applications to be used. And that would help with like real-time misinformation monitoring and plain language summaries. So whatever research that we do, we should have plain language summaries of that research. How many of you have heard of the Conversation Africa? The Conversation Africa is a group of people where, what they do is all your jargon in science, bring it to us and we step it down to the language that people understand. And it's very interesting. So such that even a child in kindergarten should understand what that's your science you were doing. Okay? And multilingual health communication, very important. So most times the francophone and or lusophone, they are always marginalized. Most times when you do things at international level, you find out that the French-speaking person can't apply, the Portuguese can't apply. Yeah. So so now AI makes it possible for whatever language you have done your work, it can be interpreted. And then literature review assistance. Okay. Now we use websites like the apps like the Research Rabbits. Yeah, to help us with literature review, and then we should keep updating our knowledge. Yes, and consensus. Human experts must review AI generated recommendations. Always remember the one thing I want to know is human in the loop. Okay? Alright? Then there's gender bias. Of course, this refers to systematic favoritism towards one gender in data methods, in methods or in AI systems. So there is usually underrepresentation of women, all right, and male-centered health studies when someone is recruiting. And it's very real. If you go to the north, right, you won't see the women now. You won't. I remember the first time I went to was that Zamfara. I was totally shocked. We were in the town for 1 hour. I did not see a single female. Where will you go and get those women from if you're doing this? You have to, it's an uphill task. So yeah, it exists. Okay? So it's the males that will come out and volunteer for your study. So you do it with them. Okay? And then so when once there is this underrepresentation and those kind of things, AI will multiply it. It will reduce it and it now becomes systematic. I remember there was a study that was done that showed that in America that AI amplified the divide between blacks and the Caucasians when it came to healthcare access, because the data that was fed into the system had shown that when people came, the doctors were more likely to treat the whites or take their illnesses more serious than the blacks. And so it now looked like it's the blacks that didn't have problems. And so by the time they set up their policy generated the system, they were just increasing the divide. Okay? So we need to be careful. And then occupational stereotypes in data sets. So you see a data set that is because it was gotten from the mine. How are the people working in the mine? It's the men. So you now see that once you make decisions based on that data, you are already taking, you're already biased. So how do we address gender bias? Audit data sets for balance. Always disaggregate your data into males and females. Collect diverse demographic data and test for AI fairness. All right? And report your gender-specific findings. Encourage diverse research teams. Yeah? I remember some of my students just did women to remember, pregnant women to remember, sorry, go for antenatal clinic. And of course, the judges just looked at them the first day, they didn't say anything. The second day, fortunately, the girl was free and she went and they said, yeah, otherwise, we would have been asking you, why is it only the males? Is it a male problem that you're, you know? So we need to be careful. Okay, all right. So we need to be representative. All right, so now, geographic representation. Why do you think that way? So geographic representation, you already know that some is just there. So there are some regions, cultures, and communities that you will not hear their voices in anything. So we need to make, yes, we just talked about the Bashiga. Yeah, you cannot reach them, you can't see them. Okay, so what you need to ensure that research reflects the diverse regions. So the challenges are that there's dominance of high income country data sets. I remember that I was doing my first study on nutritional status, and I would say that people with so, if you know about BMI, your body mass index, when you compare your height and your weight. Yes, and he kept saying that some set of people are overweight, and I kept asking myself, among whom was this study index originally? Okay, until I now found that there was a data set that they used Africans and it was Ethiopians. And I started asking, are Ethiopians representative of Nigerians? No. Do you understand? So this speaks to how much we need to ensure diversity in our data set. So that's why it is important that us here, SICSS Nigeria, generates data to feed into the global data set so that it will also be represented. Okay? So there's usually underrepresentation of Africa, Latin America, and parts of Asia, and especially rural data. Then there's exclusion of indigenous knowledge and lack of local language resources. It also speaks somewhat to the knowledge inequality. Okay, so how do we improve geographic representation? Build region-specific data sets. Do we have a data set bank in Nigeria?
No.
I don't know yet, so I'm not yet seen, but I know that NITDA is working.
They claim to have the national data,
Repository, is
yeah,
that?
but it's not dependable. We still, like, we had a conversation yesterday.
I don't know if you've heard DHS.
Yes, DHS.
Yes.
Our DHS has been there before AI.
Long before,
Yes.
every 5 years.
Yes.
So yeah, that's for when you do data, to my mind, even you go to MDS for some of these data, yeah, but they're not dependable. Sometimes another 5 years that they're supposed to make publications, and you're hanging, you don't have data. So we sometimes need to depend on international listen for things that concern the nation.
Exactly. So that's exactly what you're saying. So we need to be more intentional in building our own region-specific data sets, and then increase funding for underserved regions and partner with local researchers. Okay, include indigenous knowledge. Okay, because we also have knowledge to share with the world. Yeah, and then develop tools for low-resource languages, and we validate findings across regions. So global research requires globally representative data. Then the challenge of, sorry, okay, I think I've already talked about this. Okay, this I'm just talking about how to integrate AI. Okay, recommendations for use of AI. We need to integrate AI literacy into our curriculum. Okay, we need to standardize AI research protocols, expand multilingual data sets, invest in open science and open source publications, and promote interdisciplinary collaboration, conduct regular audits, strengthen community partnerships. So in conclusion, yeah, the complexity of social problems has increased in the AI era, and major challenges include information reliability, misinformation, disinformation, and malinformation, knowledge inequality, gender bias and geographic representation, and social scientists must acknowledge and chart the way forward using ethical, factual, and credible ways to conduct research. So key recommendations that have been made in this presentation include expanding our multilingual data sets, open source integration of AI, and then using human-in-the-loop models to always fact-check and verify AI-generated information for credible scientific research. Thank you very much for
Thank you very much, ma'am. I think